This morning we are talking about overdose deaths. Sadly, this is a topic we have covered several times. The number of teens overdosing in our area continues to rise. Cleveland ISD handed out Narcan at a middle school town hall meeting last night. The CDC says fentanyl is now the #1 cause of death for those 18 to 45 years old in the U.S. Let that sink in. 18 to 45 years old. Schools are educating students in hopes of keeping them safe. The state is putting forth nearly $4 million in grant money to implement policies and programs to prevent the use of dangerous drugs. Joining me to talk about the new grant is DSHS Director of Media Relations, Chris Van Duzen. Chris, thank you so much for coming on the show this morning to chat with us about this.
Sure thing, Zach. Good to be with you this morning.
First, I want to talk about where this money is coming from. Who is providing the grant, and did the state have to apply for this grant money?
Yeah, it's a federal grant, so it's coming from our federal partners at the CDC, and we did apply for it like other states did, and we're receiving some, and I believe there are a couple of local jurisdictions, including Harris County, that are getting some direct funds as well. And so the goal really is to, it's kind of a two-part process. Mm-hmm. We want to get our data, kind of talking to itself a little bit more. We want to bring different sets of data together so that we can better see what's happening with drug overdoses, with drug poisonings, whether those are fatal or non-fatal in Texas, and in a much faster way, really accelerate how we can see what's happening with drug poisonings in Texas, and then use that information to respond to those deaths or non-fatal poisonings and try to reduce what's happening out there in Texas.
Yeah, and I'm sure that data, that information is so critical because this situation is so fluid. Chris, break down for us if you can. We're talking about $4 million here. Where is that $4 million going to? Break down how it will be spent.
Yeah, so about $1.5 million, 1.6 million is going to go to that first phase, kind of the data piece, right? And so that's going to let us hire some new people who can, take a fresh look at that data, develop some new data systems that are going to, kind of pull these disparate sets of data together to give us a much more, kind of expansive view of these drug poisoning and what's really happening on the ground in Texas. And the goal with this is to be able to, see that at a local level, at a statewide level, and at a national level, because all states are going to kind of be feeding this information into a national system as well. And so that, we can see at all three levels of government, what's happening with this and what we need to do to respond. And then once that sort of, that data system is more robust and, we'll do some analysis with that. And then we hand it off to our partners over at the Health and Human Services Commission. They're really the substance use experts in Texas as far as responding. And they'll be able to use that information to develop programs with the remainder of that $4 million that will focus on either, reducing the number of overdoses to begin with, or giving people tools, so that those overdoses aren't, don't become fatal. So we're not seeing as many people dying from drug poisonings in Texas.
When we're talking about overdoses, this type of research, when did this become a priority?
It really has been a priority for a number of years, but it's become such a much larger issue in Texas over the last several years. Last year in Texas, we saw nearly 5,000 Texans die from a drug poisoning situation. Of course, a very large chunk of those, more than 40% are related to fentanyl. And that's really what we've seen exploding in Texas over the last several years. The number of fentanyl-related poisoning deaths in Texas has increased about 600%. Wow. In just the last few years. So that's really what's driving this right now in Texas, and something that, while this isn't confined to fentanyl, this really is looking at drug poisoning and drug poisoning deaths across any kind of drug. There certainly is a focus on opioids and fentanyl in particular.
Yeah, and as we know, this has no barriers whatsoever. I know the CDC is calling attention to that 18 to 45-year-old age group, but really there are no barriers here when it comes to overdoses.
Yeah, you're right. Unfortunately, we see, children younger than that and adults older than that, succumbing to these fentanyl poisoning deaths every year in Texas. And unfortunately, as I say, it has been growing over the last several years, which is really one of the reasons we want to make sure that we can put this money to its best use and develop strategies and new programs to help reduce that as much as possible.
Chris Van Duzen with DSHS, thank you so much for your time this morning, sir. We do appreciate it.
Thanks very much.
Absolutely.